Hey everyone, welcome to Fight Club. I'm your host, Robert Durden. I'm going to do a short show tonight, maybe two, we'll see, but at least one. I'd like to talk about something near and dear to my heart that gets me all riled up, and I'm a little bit pissed off just thinking about it. COVID and the lack of response from Trump and the lack of response from Biden, and how neither of them are doing anything that even remotely resembles what we need to do in terms of containing COVID and actually getting this under control. So let's go over the rules real quickly. Rule 1, talk about Fight Club. Rule 2, pick your battles, know your shit. Rule 3, know your opponent. Rule 4, keep the debate on topic. Rule 5, admit when you're wrong. So tonight I want to talk about a report that just got released in the Lancet. Now, I'm a doctor, and the Lancet is one of the most respected medical journals in the world. It's based in London. And they had a report in Common Dreams kind of talking about the report. I didn't read the report in the Lancet, but I read the article in Common Dreams that was synopsizing it. And there were lots of things that they studied. Basically, when Trump was inaugurated, the Lancet decided to put together a group of scientists and doctors that would monitor how Trump's administration did in terms of medical care, which is hilarious and awesome. And their report is what they're releasing now. There's 33 of them. And their report estimates that Trump's administration would have had 200,000 less COVID deaths had the United States simply adhered to some of the rules that a lot of other first world countries were adhering to. And that is bananas. 200,000 less deaths. I actually was surprised. I thought it would have actually been a little bit more than that could have been prevented if we had done something like what South Korea did, which was a hard lockdown and then mailing food and everything everybody needed to their doorsteps, including testing equipment and masks. And we had locked down for 2 or 3 weeks at the beginning, we probably would have prevented 400,000 deaths. So I was actually a little bit surprised, but I don't want to talk about that so much as comparing it to how Biden's doing. So let's assume that this is correct. It seems like it could be. It's in a very respected medical journal with a whole bunch of very respected scientists and doctors making the report. So under Biden, in a month, we have 108,000 deaths right now. How many of those could have been prevented if we assume that, the 2/5, that the 40% that Trump may have gotten or may have avoided if he had just followed the guidelines of any other major country? If we apply that to Biden, then it would be something like 50,000 deaths under Biden already are preventable because he's not really doing anything. Now, I'm going to talk about what he is doing, and I'm particularly going to focus on what he's not doing. So he's made minor tweaks around the edges, or proposed minor tweaks around the edges of Obamacare, but nothing really that helpful for COVID. He hasn't done a national mask mandate, which I thought he might do, which was the bare minimum. I don't think he's really done much of anything. Can anybody tell me what Biden has done for COVID other than recommend that the governors have stricter lockdowns? He hasn't passed any COVID relief yet, and I read today that less than 2% of his COVID relief bill, in terms of money, is actually going towards COVID stuff. A lot of it is going towards other things. Now, there are some good things like a $15 minimum wage that might be included in there. Don't hold your breath. But a lot of that bill is not bailing out people that are in need after COVID decimated their lives. So he hasn't done a public option. He hasn't done Medicare for COVID. And as we talked about on yesterday's show, he could very easily just declare a state of emergency during the pandemic and give everybody Medicare for all right this very second. The way that he did with Texas during their winter storm. He declared a state emergency in Texas due to the blizzard that they just had. And now everybody in Texas has Medicare for all. It's that simple. He could easily do that, and he's not. So we have F and D minus. But I mean, they're more or less doing exactly the same thing. And in fact, Joe Biden hasn't even gotten us any stimulus checks yet. So an argument can be made that he's doing just as poor a job as Donald Trump was. Now we'll see after the 4 years exactly how bad it gets. I expect more people to die from COVID under Biden than Trump because they're not going to get it under control. He is kind of trying to vaccinate everybody, but as a doctor, you have to get 80% of a population vaccinated to get herd immunity. Good luck getting that done in America with the amount of distrust we have in our government, amount of distrust we have in vaccinations. Oh, don't get me started. But it's going to be very difficult to reach that threshold. And I've also read that a lot of the antibodies tested of people that have gotten vaccinations or have been sick with the virus before, they no longer have antibodies left after about 5 or 6 months. So that would mean a biannual booster of the vaccine, which would be even more impossible than getting everybody 80% vaccinated. There are more problems with it. I've seen also that it might be a type of mRNA vaccine that actually does help elongate how many or how long you can have antibodies in your system. So it does give you a longer immune response and a longer memory against COVID in the future. But I mean, at best, they haven't studied it enough. So I don't know. I don't think you're going to be able to get everybody vaccinated adequately. I think you need to do things like lockdowns and try to get everybody safe and isolated and let all the infection rates drop. And then we can reopen the economy rather than just trying to rush the vaccine out and hope to God that we can vaccinate enough people to get herd immunity. That's a bad plan. So here's what I would do. And of course, I'm always going to do the best I can to use evidence to back up my claims. One of my heroes is the Prime Minister of New Zealand, Jacinda Ardern. And New Zealand has done an enormously better job at containing COVID than we have. And since the beginning of the pandemic, I have been periodically cheering them on and showing how they've done such a great job. I also mentioned South Korea because they did a great job locking down, and I like the idea of sending things to people's houses while they're in lockdown. But I brought up an article on exactly what New Zealand did, and this is what we should have done, and this is what we can do now, and I'm going to read you a very short excerpt from it. So, and this is the timeline we've got here. All right. So New Zealand confirmed its first reported COVID-19 case on February 26th, 2020. A month later, in late March, with only 100 confirmed cases, the country went into lockdown. By mid-May, however, authorities declared that the virus had been eliminated in terms of community spread, and the country reopened on June 9th, having had no new cases reported for 18 days. Even with a sizable new outbreak of the virus in August 2020, because they had a second wave like everybody did, New Zealand has seen relatively few confirmed cases and deaths associated with the virus. By January 15th, 2021, the country had only a total of 2,246 confirmed cases, or 0.04% of the population, and there have been only 25 deaths total. They have a population over 5 million people, so of course they're a smaller country than the US is, but how did they do this exactly? And what they did was wonderful, and they trust their government more than we do, so a lot of these things you would have to mandate with a stronger hand in the US than you would in New Zealand, where they simply trust their government and will listen to what Jacinda Ardern says to do. So what did they do? They used an all-of-government approach, is what they called it. And the all-of-government approach, quote, was organized along specific work streams, allowing the government to mount effective responses for disease treatment, border controls, enforcement of physical distancing mandates, social welfare and worker supports, economic stimulus, supply chain management, trade, and foreign relations. While the New Zealand government's policy response to COVID was both stringent and comprehensive, the government was able to secure popular support for these efforts through an effective and transparent effort to keep the public informed about the pandemic and their response to it. End quote. So that's something that Trump did not do well. Biden is not doing it well either. Why do they trust the government in New Zealand? And why did they have such a much better response to COVID than we did? They trust their government because their government is not corrupted by money the way that ours is. And why should we trust Biden or Trump when all they do is what's best for corporations and not best for the people or workers? So we really don't have a good choice, and we're not doing a good job now that Biden's in office. Nothing has really changed. The outcome is more or less the same. And more people are going to die under Trump, or excuse me, more people are going to die under Biden than Trump in totality after the 4 years are done. And it doesn't have to be that way. We could do Medicare for COVID right now, just state that we're in a national emergency due to the pandemic and give everybody health care. Get the goddamn stimulus checks out. $2,000 retroactive to March, $2,000 a month, but at minimum $2,000 one time, and then do a lockdown like they did in South Korea or in New Zealand. Do an actual lockdown for 4 to 6 weeks, send everything that we need to our doorsteps, and that includes food, feminine hygiene products. If we need to, people need clean water or anything that they need, set up a government service to deliver it to people so that they can stay quarantined. Other than that, you're not going to maybe ever get everybody vaccinated to the point of herd immunity. And if you do, it could be 5 years after Joe Biden's out of office. So that's coming from a doctor. Don't take my word for it. But if all that Joe Biden's going to do is push the vaccine, it's still not going to become safe to go out in public. It's not going to become safe to go to your job just because 40 or 50% of people are vaccinated, especially if it turns out you need bi-yearly or tri-annually boosters, which, let's see. But, I don't think Biden's doing much better of a job than Trump is, and that should be the point. We don't have anybody that's actually doing the right thing, unfortunately. So I wish that we would just do things like the other countries did, and perhaps now we would have 100,000 deaths instead of 500,000 deaths. And perhaps at the end of the Biden presidency, there'll be 1 million deaths. But there could have been, there's 500,000 or 400,000 under Trump. Perhaps 200,000 more could die under Biden. It would be a total of 600,000. But he doesn't care, because most of those people that are dying are the uninsured, the impoverished, the poor people. And he doesn't give a damn about us. So that's all I've got for you tonight. I don't think either of them are doing a good job. And if you want to, just declare a state of emergency, give everybody Medicare for all, have everybody locked down, and give us stimulus checks. It's not that fucking hard. Seriously. Keep fighting the good fight out there, guys. I'll talk to you later.